The history of the University of Maryland medical system is a story that is focused on an incredible journey that demonstrates the power of leadership, the power of partnership, and the success of privatization. What you're about to hear is from the very leaders who helped shape the formation of our medical system and create a foundation upon which our future is built.
What started as a single location on South Green Street has evolved so much. Now a unified system across the state, the University of Maryland Medical System celebrates all it has accomplished in 40 years.
If you looked at the University of Maryland Medical Center like a car that wasn't quite functioning well, but you put up the hood and you looked down in there and you said, you know something? If we could replace this part, if we could connect these wires, this place just has huge potential, just huge.
The hospital was more or less a state-run hospital. Of course, at the time, the University Hospital, the one big program that they had that was recognized across the state was shock trauma. An individual named Dr. Al Farmer said, I don't think this hospital is going to survive in this environment.
He always thought ahead. He always had ideas of the future and how things were going, and so he felt that that was the way to go.
Al Farmer was, in many respects, the visionary of our privatization. He had this idea that the university and the hospital should be a separate enterprise.
They came up with a collaborative bill that started in the House that would privatize UMMS, create UMMS and privatize it, separate from the university.
The long and short of it is, through a number of years and a whole bunch of driving down to Annapolis and back in 1984, legislation passed extracting the hospital from the university itself. That's also the day that Dr. Al Farmer died. He died on the very day that all that work got done.
After he died, I was just in shock for a long time, but I was just very happy to be a part of it, to be there for the signing, because I knew that, that was what he wanted, and had worked so hard for communicating with all different people and legislators and other people in the community.
On July 1st, 1984, the University of Maryland Medical System was created.
Over the next few years, the state supported us, because I'm sure when they separated us, they hoped they were done with having to support UMMS. Not true.
It was a kind of a unique arrangement, a public-private relationship that ultimately leveraged the resources of the state, but allowed the University of Maryland Medical System to become more entrepreneurial, move out of the state mentality, and move into this enterprise environment, and therefore be competitive.
Called a system, it really wasn't one at this point. It was simply the downtown campus and the Shock Trauma Center.
I said, well, Mort, we have the keys to the car. It's, it's privatized. I said, well, where do you want to drive it? I said, I guess we want to be like Johns Hopkins, right? And we looked at each other and we said, no, that's not who we are. Our strengths are our relationships with the state, with the School of Medicine, and with the physicians all around the state, because we had trained with the school over half the doctors who practiced in Maryland.
We had both the vision for high-quality care, but also to be an independent enterprise. And I emphasize enterprise because folks didn't think of a hospital or think of us as an enterprise.
That first couple of years, because the clinical chiefs really wanted to do parts of it. They liked running their own ship, and they didn't want to be bothered. And that for Steve Shemp played a major role, being the liaison between Mort and the clinical chiefs.
Roger came on as board chairman after Frank Gunther stepped down. And Roger had a conversation with me early on in his leadership as chairman, when he said, Mort, you're going to have to figure out how to work with these folks as partners.
The medical school was used to being in control of the hospital, and now the hospital had to be accountable
for their own results. The hospital couldn't function without the doctors, and the doctors couldn't very well function without the hospital. And they better figure out a way to get along and be good partners, otherwise they were putting the business at risk, because bad partnerships tend to fail.
They're really two separate entities. And you have to work together because you want to work together, not because you have to work together. I can almost remember the day that Mark Rappaport and I agreed to it. Took a while, but we agreed to it. It was a whole new world, because Mott understood what needed to be done.
It was a long struggle, but a lot of people came aboard after a few years, and the recognition was there. They provided good medicine, and that allowed the public relations aspect to come forth and to expand the whole operation.
From those early days to what we are now, this didn't happen by chance. It was through the vision and efforts of many who believe in delivering a better state of care.
We went from the recapitalizing phase and building the clinical program to expanding the footprint to the multi-hospital system we are today, with a $5.5 billion system that is caring for most of the Marylanders in this. It is the biggest Maryland system. All that starting with that 1984 legislation that basically created the University of Maryland medical system.
I was very excited about the hospital acquisitions that we made during my time. We were calling ourselves a system, but we really only had a couple of hospitals. With all the acquisitions we made, we are a statewide and a nationally renowned medical system that doesn't just serve downtown Baltimore, it serves all the county.
It's something that's constantly changing, like all medical systems, but it's an aggregate of hospitals and medical services across the state that have pulled together various integrated relationships in order to improve the quality of medicine for the state of Maryland.
We never dreamed UMMS would be what it is today, $5.5 billion system.
I just think that what has happened has been almost a miracle.
What it is today blows my mind. I left the board when it was still only the downtown campus. That was the only thing that existed. So if you live in the state of Maryland and don't know something about UMMS, you've probably been hiding in a cave.
Now it really is a system. They're good hospitals, very good hospitals, and they're also providing very good care.
It's no longer a bankrupt medical center. It's one of the finest teaching medical centers in the country.
I've witnessed the quality of care expand. That allowed us to advance the development of transplant, both at the face transplant and then later on when we had xenotransplant, the xeno heart transplant. So that's an example of broadening of your clinical expertise made possible by that collaborative environment.
The greatest challenge we faced was dealing with the COVID-19 pandemic, the greatest healthcare crisis in the last century. And we partnered with the city, the state, our colleagues at Hopkins Medical System to provide outstanding care to meet the dynamic needs of our community while still providing great and compassionate care.
A lot of hard work, but and you see it today. I'm just so proud of it, to see, whatever we have, 14 hospitals, or depending on how you count them. So it's quite a story.
I guess I'm most proud of the process of privatization when a lot of folks didn't think it would work. The board of directors that I had over time recognized that we were creating a system that was improving the quality of care and also the enterprise. What made me grateful and proud was that we were profitable.
Some of the things I'm most proud of are strengthening the medical system to the point that we would be an attractive partner for community hospitals.
Really just a lot of pride and joy to see the growth.
Gratefulness.
Grateful.
The car we're driving today is very different than what we were trying to drive in 1984. The leadership team needs to constantly be investing in making that vehicle stronger, more efficient.
We're incredibly fortunate to have the most dedicated and talented team of medical professionals. And one of their extraordinary attributes as a team is their ability to adapt to change while remaining committed to delivering outstanding health care for all.
I think Maryland's going to continue to do what it's always done, which is provide high quality medical care to every patient who comes through that door. I'm optimistic that it's going to continue to do a marvelous and fantastic job.
Our future is very bright, and the University of Maryland medical system will continue being champions for the citizens of Maryland.
We are profoundly grateful for those who came before us. They set the foundation upon which our future is built. The lessons that we learn from those who came before us represent the approach to our future. We must, as a health system, continue to transform. We must understand the evolution that is occurring around us and position our health system to continue to be an incredibly unique resource to the citizens of Maryland. We love to say that we wake up every day thinking about Marylanders, and by doing so, we will influence the future of healthcare in our cities, in our state, in our nation, and indeed the world.